In the early 20th century, infectious diseases were among the leading causes of death worldwide. Diseases like measles, diphtheria, smallpox, and polio routinely killed or permanently disabled millions of people each year. Today, many of these diseases are rare in large parts of the world. Some younger generations have never seen a case of polio or diphtheria in their lifetime. But this transformation did not happen by accident. It happened largely because of one of the most powerful tools in the history of public health, vaccination. Vaccines have prevented an estimated hundreds of millions of deaths globally and remain one of the most cost-effective public health interventions ever developed. But vaccines are not just a medical technology. They are also a social, economic, and public health system that requires science, policy, trust, and global cooperation. In this video, we will explore how vaccines actually work in the immune system, how vaccination protects entire communities through herd immunity, the historical impact of immunization programs, the modern challenges of misinformation and access, and what the future of vaccines may look like. Hi, my name is Ellie. Please subscribe to my channel to learn more about public health. To understand vaccines, we first need to understand the immune system. The human immune system has two main components, innate immunity and adaptive immunity. Innate immunity acts as the body's first line of defense and includes physical barriers like the skin, chemical defenses like stomach acid, and immune cells that respond quickly to invading pathogens. But innate immunity is relatively non-specific. The real power comes from the adaptive immune system, which can recognize specific pathogens and remember them for future encounters. When a virus or bacterium enters the body, specialized immune cells called antigen-presenting cells break down the pathogen and present fragments of it, called antigens, to other immune cells. This activates B cells and T cells, which play key roles in adaptive immunity. B cells produce antibodies that bind to pathogens and neutralize them, while T cells help coordinate immune responses and destroy affected cells. Crucially, some of these immune cells become memory cells. These memory cells can persist for years or even decades. If the same pathogen enters the body again, the immune system responds far more rapidly and effectively. Vaccines take advantage of this biological memory. Instead of exposing the body to a full, dangerous infection, vaccines introduce a safe form of the pathogen or its components, allowing the immune system to develop memory without severe disease. Different vaccines use different strategies, including inactivated vaccines, which contains killed pathogens, live attenuated vaccines, which use weakened forms of a pathogen, subunit vaccines, which contain only specific pieces of the pathogen, and mRNA vaccines, which instruct cells to produce a harmless antigen temporarily. But for all of these, the goal is always the same: to train the immune system in advance. Vaccination reduces the number of susceptible individuals in a population. When enough people are immune, the effective reproduction number drops below 1, preventing sustained transmission. The threshold for herd immunity depends on the disease. For example, measles is extremely contagious, with an ROR/ORO between about 12 and 18. This means around 95% vaccination coverage is needed to maintain herd immunity. Polio, on the other hand, requires lower coverage but still substantial vaccination rates. Herd immunity protects people who cannot be vaccinated, including infants who are too young, individuals with compromised immune systems, and people with medical contraindications. In this sense, vaccination is both a personal health measure and a collective responsibility. It helps to look at historical data. Take smallpox, for example, one of the most devastating diseases in human history. For centuries, smallpox epidemics killed millions and left survivors with severe scarring or blindness. In the 18th century, the physician Edward Jenner discovered that exposure to cowpox could provide protection against smallpox. This insight led to the first modern vaccine. And, nearly 2 centuries later, a massive global vaccination campaign coordinated by the World Health Organization succeeded in completely eliminating smallpox. In 1980, smallpox was declared eradicated, the first, and so far only, human disease eradicated through vaccination. Let's look at another example, polio. In the mid-20th century, polio outbreaks caused widespread paralysis and fear. Vaccination campaigns using the Salk and Sabin vaccines dramatically reduced global cases. Today, polio remains endemic in only a few regions around the world, and global eradication efforts continue. Vaccines have also drastically reduced diseases like measles, diphtheria, tetanus, and pertussis, which is whooping cough. In many countries, childhood vaccination programs have transformed what used to be common and deadly illnesses into rare events. Despite these successes, vaccination programs still face major challenges. One challenge is vaccine access. Many vaccines require cold storage and careful transportation system known as the cold chain. Maintaining these systems can be difficult in remote or low-resource regions. Organizations such as Gavi, the Vaccine Alliance, and UNICEF work with governments to expand global vaccine coverage and ensure that life-saving vaccines reach underserved populations. Another challenge is vaccine hesitancy. Public health researchers define vaccine hesitancy as a delay in acceptance or refusal of vaccine despite availability. It can arise from multiple factors, including misinformation spread through media, distrust in institutions, cultural beliefs or historical injustices, or concerns about safety. Addressing vaccine hesitancy requires more than just scientific evidence. It requires effective communication, community engagement, and trust building. As said before, public health is not only about biomedical science, it is also about social science. The science of vaccination continues to evolve rapidly. Recent advances in mRNA vaccine technology have demonstrated how quickly new vaccines can be developed in response to emerging diseases. Researchers are currently working on vaccines for diseases that have long been difficult targets, including HIV, malaria, and tuberculosis. Scientists are also exploring therapeutic vaccines, which could train the immune system to fight diseases like cancer. Other innovations aim to make vaccines easier to distribute, including microneedle patches, heat-stable formulations, needle-free delivery systems. These technologies could dramatically improve global access to immunization. Vaccines, till today, represent one of the greatest achievements in public health. They demonstrate how scientific discovery, international cooperation, and large-scale public health infrastructure can dramatically improve human well-being. But their success also depends on sustained commitment from governments, scientists, healthcare workers, and communities. Because ultimately, vaccination is not just about preventing disease today. It is about shaping a healthier future for entire populations.